Hello everyone. It has been a while since we had a video update regarding the coronavirus. We know the last 6 months has been a trying time for everyone, and we're hopeful some of the information in this report will provide you with useful tools that you can share with your friends and family as the country looks to possibly reopen once again. Let me begin by saying that the information I'm providing today is based on the science of the virus. The report does not make conclusions or provide estimates about reopening, virus spread, or any other subjective talking point. It's my goal to give you information from reputable sources that addresses the facts about the current condition of the pandemic and where it looks like we're headed. Of course, no source is perfect or correct 100% of the time, so you're going to have to kind of decide whether the information provided is accurate and useful to you. So let's get started. WKS is a restaurant company with operations in 17 states and many counties. So in order to be prepared to reopen and operate safely in any of these areas, we monitor all 17 states where we have operations and about the same number of counties every day. Risk management creates a report for senior leadership every morning that identifies areas that are performing good and bad with the virus so that our decision making is as timely and well informed as it can be. We know how important it is to many of you that we are ahead of the curve, so we're diligently looking at the data to make sure we get it right. We use several reliable sources for the information. We feel using more than one source to monitor virus activity gives us multiple ways to look at the data. The last thing we want to do is rely on one source only to find out that the data was corrupted and we made bad decisions because of it. California recently went nearly 2 weeks reporting incorrect statistics about the spread of the virus and had to spend a lot of time and taxpayer dollars to remedy it. By using information from the Centers for Disease Control, Johns Hopkins University, Worldometer, USA Today, the New York Times, and the COVID Tracking Project, and along with several other data sources, we're confident that the information we have is the most accurate and up-to-date reporting available. If you're ever curious about the sources we use, please send me an email at mike.simmons@wksusa.com and I'll send you a few of the links. Who knows, you may want to start reporting virus updates to your family and friends. The data is only half the formula. There are actually 5 primary factors that the country and the states use to determine the track of the virus and evaluate whether the controls that are in place are actually working. These 5 factors are data-driven methods for the government and health experts to monitor the progress of the virus and to decide how best to counter the spread and save lives. So let's talk about the 5 factors. The first factor is what we call an alert level. The alert level uses a combination of the data from the other 4 factors to create a color-coded, at-a-glance way of looking at a state's performance against the virus. The 4 color codes are red, orange, yellow, and green. Red indicates the state has an active outbreak that is largely uncontrolled. Orange means the state is at a higher risk for an uncontrolled outbreak and should be actively managing resources to stop it. Yellow means the virus is spreading slowly but is still a threat. And green means that the state is on track to contain the virus and can likely reopen faster than states with other color codes. As of today, there are no states in the green category, but states in the Northeast like New York, Vermont, Maine, Massachusetts, and Connecticut are soon to be there. I'll provide you with the alert levels from some of the states we're monitoring toward the end of this report. The second factor is what we call the positivity rate. The positivity rate is the number of positive tests from a large group of tests. In other words, if a group of 100 people are tested, and 7 of the people tested are found to be positive for the virus, then the positivity rate of the group is 7%. The U.S. government and many of the states are targeting a positivity rate of 3% or less. Anything below 3% is considered very low and is interpreted to mean the state or county is generally in control of the spread of the virus. If the state or county is in control of the spread, it's much more likely they'll be given the green light to reopen sectors of the economy, to include restaurants. As you can imagine, the positivity rate is also very important to WKS because even if this piece of data is or isn't factual, the government is relying upon it to make decisions about reopening, so we need to stay on top of it. Areas with very high positivity rates will likely not reopen for weeks or months, and very high positivity rates are considered to be anything above 10%. I will tell you what states we think that are doing well in the 5 categories at the end of this report. The third factor is the infection rate. The infection rate tells us how many people an infected person is likely to infect based on the contact tracing effort in that state. As people become infected, the health departments try to identify the number of people they may have infected to identify an infection rate for that individual, and then they estimate the number of people others may have infected using that same data. For example, if a state has an infection rate of 1.20, the data is telling us that each infected person in that area is infecting at least one other person, and very likely infecting more than one. The target by the CDC for the infection rate is a 0.90. Once a state reaches this infection rate target, it will be assumed infected people are infecting less than one other person, and this will lead to a reduced positivity rate and less virus spread. The fourth factor is the healthcare system capacity rate. The other factors I mentioned deal largely with the frequency of the spread of the virus. The healthcare system capacity rate addresses how severe the virus is to the population and how resources needed to properly treat people have been strained. If the healthcare system capacity rate for a state or county is above 50%, that means that there are fewer beds, ventilators, and doctors available to treat the really sick people, and that can increase the likelihood someone will die because they won't have access to the treatment they need. Anything above 50% is very dangerous for the population of that area, and this rate is constantly monitored for any sudden increases that could spell trouble. The last factor we monitor is the new case rate. The new case rate is the number of new cases that have been reported to state and local officials by hospitals, testing centers, etc. The rate is determined by figuring out how many new cases have been reported for every 100,000 people there are in that area. By using a per capita number to create the rate, the data becomes evenly evaluated regardless of the number of people that there may be in a state or county. If we didn't do this, states with larger numbers of people may look like they're doing worse than states with small populations, when the opposite could be true. The target for the new case rate is 0, but no states are currently there. A more reasonable target is a rate of about 5 for every 100,000 people. Admittedly, this factor is the least accurate because in order for a new case to be included in the rate, the infected person has to go to a testing center or hospital, they have to test, get a positive result, and have that result reported to the data crunchers. Even so, this number is really important to the government decision makers, so we monitor it every day. Now that you know what we look at every day, let's give you an idea what we're seeing out there. Based on the report of the states we monitor from August 20th, we feel the states of New Mexico, Oregon, and Colorado are most likely to reopen their economies before other states. This is true because each of these states is in the yellow alert level, currently has a positivity rate below 5%, an infection rate below one person infecting another, and a healthcare system capacity rate of less than 20%. They also have a new case rate lower than any of the other states on our list. On the other end of the list, we have states like Nevada and Texas that still have some work to do. These two states have positivity rates over 10%, and the healthcare capacity rate is above 50%. Texas is trending downward, so we hope to report soon that they'll be closer to reopening. Other states like California, Arizona, and Utah are trending down now in all of the factors, so we may have something very positive to report there in the next week or so. Well, that about covers the COVID report for today. Remember, if you want to see a sample of the report or have any questions about the virus, please send me an email, and I'll get you a PDF version of the most recent report and an answer to your questions as soon as possible. As always, stay safe, wash your hands, physically distance, and wear your face covering. Have a great day.